Okay, our next exam is the L spine. We'll go through the AP, both obliques, the AP axial spot, the lateral, and the lateral spot. So our centering is at the iliac crest. You want to make sure that the patient bends her knees to reduce the curvature of the spine. Stretch them out just a little bit. There we go. You can even put a sponge under their legs. There you go. That'll help you see your anatomy a little bit better. So our CR is at the crest. We're going to collimate in. We want to make sure we include T12 through S1 in the AP. Okay, now we'll switch to the obliques. If you'll ask the patient to roll on their left side. And then we're going to roll back. There we go. I'm just going to position the patient. Just position them the way that you need them to be. So we're going to go 1.5 inches above the crest, 2 inches medial from the ASIS. There we go. Rotate just a little bit more. Okay. And roll your head all the way. There we go. Great. So if you'll go back and look at the head of the patient, they should be lined up with the ear. And we're looking for the zygapophyseal joints here. We should see the Scotty dogs in an oblique position. Okay, so now we're going to roll over to the other side. Roll over to the right side, put our sponge behind our patient, ask them to lean back. We'll bring their arms over. There we go. So 1.5 inches above the crest. Sometimes they move just a little bit, so we want to make sure we have the right centering on both obliques. Okay, turn your head, there we go. If we look at the head of the patient, make sure they're lined up with the ear. Okay, so now we're going to go to our AP axial spot projection. So ask the patient to roll over on their back again. We can put the sponge under their legs. Go. So this position is 30 to 35 degrees to the ASIS. So for females, it's 35. We're looking for the L5-S1 joint space. With the angle, be sure to line up your tube and bucky. Then we'll position our patient in the mid-sagittal plane to the ASIS, and we'll collimate. So now we're going to roll over to our left side. Our last two positions are left lateral and lateral spot. So just make sure that you move the patient, that the patient is nice and straight. I'm going to move your shoulder back. You want the shoulders and the hips at equal distance apart. So our centering is going to be to the iliac crest. And again, where your where the patient's abdomen kind of dips in. That's usually where the crest is. We're going to move back just a tad and put your left marker in the light. And we always want to put a lead mat behind the patient. It absorbs the scatter and helps with image quality. Okay, and we'll shield the patient where we can. So our last position is the lateral spot. We're going to angle 5 to 8 degrees. Our centering is 2 inches, a couple fingers beyond or posterior to the ASIS. Collimate. And again, we want to see this L5-S1 joint space in a lateral view. And remember, with the L-spine, we do want to ask the patient to put on a gown so we aren't showing the artifacts of their jeans and zippers.